Welcome back. We're talking about glaucoma, the sneak thief of sight. Now, if you want to ask questions about glaucoma, the number to call is 0808 054 2233. That's 0808 054 2233. And you can tweet at CTV_Mary A. Now, the sneak thief of sight. Can we prevent this thing ever happening? So let somebody not even have glaucoma. Is it possible?
Well, for now, glaucoma cannot be prevented because we really don't know the root cause. We know what we call risk factors for glaucoma, which include a positive family history. So if your parent or sibling or child has glaucoma, you're at increased risk, fourfold increased risk of having glaucoma. Blacks are also at increased risk. So we, by being Africans, we're already at increased risk, a 4 times increased risk as well. The older we get, people more than 40 years have increased risk of developing glaucoma. People that are short-sighted, people that have raised intraocular pressure. The higher the intraocular pressure is, the higher the risk of developing glaucoma. Also, people that are hypertensive or people that are on antihypertensive medications, diabetes. So these are conditions that...
People on antihypertensive medication?
Yes.
Shouldn't that bring down the pressure?
Oh, yeah, it brings down the blood pressure, but it's been noted that those who take their antihypertensive medication, especially at night, they tend to have a nocturnal dip in their blood pressure. And this coincides with when the intraocular pressure actually goes high. And so you find out that the optic nerve head is not well perfused. And so this damage where the optic nerve doesn't get enough blood supply can lead to glaucoma in these patients as well. And so glaucoma really cannot be prevented. What we advise people to do is that once you have a risk, and we are all at risk, is to have a regular eye check. If we have frequent eye checks every couple years, at least until we are 40, and even every year after the age of 40, so this can be detected. It cannot necessarily be prevented, but blindness from glaucoma can be prevented by early detection and appropriate management.
You said we are all at risk.
We are all at risk.
Because we're black.
Because we are black.
And because blacks are more likely to get it. So would you say this to Caucasians, for example?
Caucasians are not as... The risk is higher in blacks compared to Caucasians. So we are more at risk than they are, actually.
That means a checkup for everybody.
A checkup for everybody, yeah.
Okay. Now, this is pretty serious because people don't go check their eyes. People don't go check until they have pain, and there's no pain.
There's no pain. There's no blurry vision. Yeah.
Eniola, hello Eniola. Hello Eniola, are you there? Oh, that's Emeka. Emeka.
Yes.
No, I can't hear Emeka. I can't hear Emeka. So let's continue.
I'm hearing you.
Now, with surgery, what are the success rates? Because you said you can actually stop the progression.
We can slow the progression. So
not stop.
Glaucoma, well, we aim from slowing. Hopefully, we hope to stop it. But glaucoma is a lifelong treatment.
Let's see. Emeka seems to still be on the line. Hello, Emeka, are you there? I don't seem to be hearing Emeka. We'll have to go on. But do keep trying. Do keep trying.
So it's a lifelong treatment, and there is no one treatment that would say that's successful for everybody. It's something that your ophthalmologist is going to determine which is best for that patient. The treatment of glaucoma is actually individualized. Sometimes it needs just drops, it needs just laser, it needs just surgery, or a combination of all three, or a combination of two. So there is no one treatment to say, oh, that's the perfect treatment for glaucoma. It depends on that patient.
Does it always affect both eyes?
So the primary glaucomas usually affect both eyes, but it can be asymmetric. That means it's not equal. One eye could be worse than the other. But the secondary glaucomas, which can occur from trauma, which can occur from polycontrolled diabetes, which can occur from medications like steroids, those ones can be can occur in only one eye, depending on what's causing it. And so for primary glaucoma, it's usually both eyes, but one eye may be far advanced than the other eye, which is why some patients get to know when they have lost vision in one eye, and then they come for this other eye. That's when they know that they have glaucoma.
By that time, 40% is gone.
No, when they have lost vision, when they become symptomatic, it's almost 75%. The 40% is for us to detect it using visual fields.
Oh.
Yes. By the time the patient starts having symptoms, almost 75% is gone.
Okay, so how often, based on all this information, how often should somebody go for an eye checkup?
So I would advise any individual who is less than 40 to have an eye check every 2 to 4 years. If you're given a clean bill of health, don't think, oh, that's good, I don't have glaucoma. Get your eyes checked in another 2 to 4 years. However, if you have any of all these other risk factors, then you should have an eye check more frequently. So not just because you're black, but if you